This.
DIS.
Hello. My texts are probably
I did read it. So what's the benefit to that?
How are you?
Why are
Yeah.
you?
So
My name will be
You want to do the cookies?
waiting for you. These students who I don't know because I'm not there with somebody else that's doing it, and so I don't know if she's volunteering for them. So I want to get to know school around here.
Tell me afterwards.
Oh no, they
Oh, it's fine. It's okay.
Someone's there in the first row. Yeah, that's okay.
Here, let me carry that. I got it here.
Oh, thank you.
Yeah.
What's it called on the back?
Oh, are we live?
Yes.
Oh, sorry.
Dr. QJ would just. She said she would be there.
Okay.
Do we need to be quiet?
No. No.
There's nothing, we just finished early. Did she get you?
Yeah.
We would just start.
Yeah, let's do it. Do you want to introduce what tonight is? Because this is an awesome. Thank you.
Alright guys, thank you guys so much for coming. I appreciate your patience as well. So we have Joseph and Tyler, and they will be our private president. And then we're going to be presenting to you guys the English and Transgender Voice. And then do you guys want to talk a little bit more about it?
Yeah. So, surprise everyone, I work at the Pride Center on campus. I'm full-time staff. I supervise the center, supervise the student team, which includes Tyler. The mission of the Pride Center is to provide gender and sexuality inclusivity in our campus. So one of the ways that we're collaborating with NISLA is providing the culture competent portion of what you will eventually learn with Dr. KJ, which are the actual voice therapy techniques for transgender voice training. And we're calling it training and not therapy because it's not a problem that needs to be fixed. It's a skill that the client wants to acquire. So what you're going to learn from Tyler and I are just more of the cultural components, what's appropriate, what's not, and then we'll go from there. But I'll start by introducing myself. I'm Joseph Kayanan. My pronouns are he, him, his, and I'm the Pride Center supervisor.
My name is Tyler Neros, and my pronouns are he and his, and I am the Student Administrative Support Assistant for the Pride Center. I used to be a student assistant at the Pride Center.
Yeah.
So whenever I do a Trans 101, I'd like to start off with this quote. It is revolutionary for any trans person to choose to be seen in a world that tells us we should not exist. By Laverne Cox, who is Marketing Black, and she is one of my trans icons. And so we're going over some ground rules for today. What's stated here stays here. So if I tell you some personal information, please do not tell that to anyone else. Practice self-care. If you need to step out or something gets really too concerning and you need to step out, please do so. Take care of yourself. We always practice self-care at the Pride Center, so practice self-care here. Respect others' pronouns and identity. So please respect my pronouns. Please respect Joseph's pronouns. And then ask questions if you have a question. Don't be afraid to ask. This is probably the only time you'll ever be asked a ground person. So please ask. Begin.
We have a relatively medium-sized group here, and it's pretty intimate. So what I would like to do is, I already know y'all, I'm a student, but for Tyler and myself to get to know all of you, your names and what your gender pronouns are. So for example, Joseph, he, him, his, and then I want to just go down the rows. Who are you?
Hi guys, my name is Jasmine Rojas. I am a second-year graduate student and your initial president. And my pronouns are she, hers.
Yeah, and if you didn't know, there's some pronouns on the screen. She, her, hers, he, him, his, they, them, theirs, or is he, here, hers. It's just something we always do whenever I introduce someone, myself. I was like, my pronouns are he and his. just so that people know, so that they don't misgender me in the future, even though it happens, but at least they know initially that these are my pronouns and these are what I identify as, just so that there's no confusion in the future.
Carry on.
I'm Jermaine, I'm a grad student, and my pronouns are she, her, hers. My name is Vivian or Viviana, whichever you prefer. And I'm a graduate student. I'm the CSUN treasurer for this school year, and my pronouns are she, her, hers, and herself.
Hi, my name is Andrea. I am an undergrad student. I am also a membership officer for NISHLA, and my pronouns are she, her, hers, herself.
I'm Kimberly, I'm an undergrad student here. My pronouns will be she, her, herself.
Hi, I'm Anissa Hernandez. I'm an undergrad. I'm also part of NISLA. I was previously the social media chair, and now I'm the student faculty liaison. I identify as she, her, hers, and herself.
Hi, I'm Hillary. My pronouns are she, her, hers.
Hi, I'm Eugenia. My pronouns are she, her, hers.
Hi, I'm Erica. I'm an undergrad and I'm she, her, hers.
Hi, I'm Masha. I'm an undergrad and I go by she, her, hers.
I'm Lauren. I'm a graduate student and my pronouns are she, her, hers.
And I'm Dr. Kochis-Jennings. My pronouns are she, her, hers.
I'm Karen and my pronouns are she, her, hers.
Everyone, I'm Lauren, and my pronouns are she, her, hers.
I'm Jacob. My pronouns are he, him, and his.
I'm Christine. I just graduated last semester. Some of you might recognize me from downstairs in the clinic. My pronouns are she, hers, and hers.
Hi, I'm Laura. I'm an undergrad student. This is my last semester here, and my pronouns are she, hers, she, her, and hers.
Hi, I'm Angie. I'm an undergrad, and my pronouns are she, her, and hers.
I'm Crystal, and my pronouns are she, her, and hers.
Hi everyone, I'm Yu, and my pronoun is she, her, hers, herself.
Awesome, thank y'all for participating. First question, why would I start off with asking pronouns? Why are pronouns?
Because you can't assume that somebody goes by certain pronouns just by how they present.
Awesome. Thank you. Can't assume anyone's pronouns. Just don't assume anything at all. Just say my name is so-and-so and my pronouns are insert pronouns here. That's the easiest way to know someone's pronouns, and that's the easiest way to identify someone.
And just to give some perspective on it, when you do identify like a stranger or someone that haven't disclosed what their pronouns are to you, the pronouns that you're using for them are ones that you're basing on their gender expression. So gender expression is separate from gender identity, because gender identity is something that someone claims for themselves. So when Jasmine introduced herself, she said what her pronouns are. I didn't say that's Jasmine and her pronouns are she, hers, because that's not my responsibility to say. But if I was basing on Jasmine's gender expression, which is more feminine, I could infer that her pronouns are probably she, her, hers.
So here's the agenda for today. Sorry, I'm going to be speaking a little bit fast because usually our trainings last an hour. Since we have a little minute amount of time, it's going to be fairly quick. But if you have questions, don't feel free to ask. And also, you can go visit the Pride Center to ask questions, or if you want to do follow-up, I can give you my email, things like that. So we're going to go over terminology. We already went over pronouns. Microaggressions and privilege, transphobia, and how this can relate to you, and then talk about allyship. So we're about to deconstruct your gender right now. So your gender identity is how you identify yourself. That's your gender identity, and it's how you would like other people to perceive you. So your gender identity can be the same or different than your sex assigned at birth.
Well, that is.
And then your sex is biological. So gender in your head and your biological sex is your genital region, which is why we use transgender, because it's about your gender identity and not transsexual, because that's more focusing on genitalia, which isn't always true. and it's very binary, which I will get to in a second.
Yes. So we like to, so when we say deconstruct gender, so people whose sex at birth is in alignment with their gender identity, that's gender privilege. I have gender privilege because I was born male, identified male by my doctor. I didn't get to say what I was, and I grew up thinking that I was male and knowing and affirming myself that I'm male. So really, all my life, I may have used gender and sex interchangeably because for me, that's my reality. For someone who's gender non-binary or transgender, that might not be the case. They may have been assigned female at birth, but they grow up knowing that their gender identity is male or more on the masculine side, and there's a disconnect not because what they're thinking or what they're feeling is incorrect, but because society views them to a certain expectation because of the gender identity. Yeah.
And so LGBT. So LGBT, lesbian, gay, bi is sexual identity, while the T is more focused on gender identity. Something I like to think is that LGBT is who I want to go to bed with, and your gender identity is who I want to go to bed as. Just so that we can get that straight out there. Because people often confuse, oh, I'm an LGBT advocate, but then I only want same-sex marriage. But that's not the only things that we want in the community, because we have people that are facing different situations because of the T and different expression. And so our sexual identity, gender identity are different from one another, and it's important that we talk about it more because people often get it confused, because they would say, well, if you're trans, why are you gay? I don't understand. And I'm just putting it out there that they're two separate entities for one another. That you can be trans but still be gay. You can be trans and still be bi. They're separate from one another. And we'll explain more with our next picture. The gingerbread person. This picture will change often. There are multiple variations, but this is the easiest tool to teach people, especially relative to trans issues and things like that. So as you can see, gender identity, there's a spectrum. Woman, genderqueer, and man. So your gender identity is in your brain. It's up here. Your gender expression is how you express yourself. I identify more on the masculine spectrum. In your biological sex, female, intersex, male. So my biological sex is female. I was female at birth. In my sexual orientation, hetero, bisexual, gay, identify as bisexual, for the most part. And so as you can see that these are all separate entities from one another, and that it's important that when you see someone, you don't assume where this person stands. Only they know where they stand. So it's important to know that you may see something different, but their identity may be something totally different, depending on where they're transitioning lives and things like that.
Yeah, so just to reiterate, like these are different components and they could be different on any given person. My inference from just gauging the people in the room is most of y'all probably identify as female, express more femininely, are female assigned sex at birth, and then are heterosexual, right? For example, other straight men would be their gender identity is man, they're masculine, they're super bro-ish, their biological sex is male, and they're like super duper straight, right? But that may be a reality for a lot of people, but there are folks in the LGBT community who identify as a woman, express themselves more androgynously, were born, sex assigned at birth was male from the doctor, and they identify as pansexual, which isn't even on here, but pansexual is a sexual identity that's on the spectrum. And it's just really this visual is to illustrate to you that it's not linear. It can be, and for a lot of people it is, but in order to be more gender and sexuality inclusive, just understanding that these components are very much separate and can be separate, and that anyone can have, can identify anywhere along these spectrums and make up their holistic whole identity.
And these identities can change over time. Don't think that it's just a constant, I'm always going to identify as a woman forever and a day, but it may change, you never know, especially your gender expression. Depending on where I am, I may dress more feminine or more masculine in certain aspects. It just depends on the situation and day and things like that.
When we're going, I have to. So when I was first learning about the trans identity, because I'm cisgender, I don't identify as trans. One of the misconceptions that I had going into it was that people who are transgender may be transitioning to be straight, and that's a thought that a lot of people have, and it's not an unreasonable thought. But part of our presentation today is to help you demystify that. There are actually a lot of trans folk who identify as bisexual or gay, using their gender identity as the marker. So for some trans folk, they may be transitioning and then now identify as straight or heterosexual, but that's not always the case, so don't get stuck in that mindset, yeah.
So what is transgender? Transgender is an umbrella term for whose gender identity and or expression is different from their sex assigned at birth. So me, basically. I was assigned female at birth, but I identify as trans. I'm more on the non-binary spectrum, and we'll get to that later. But don't think that just because there's this word that no one else can identify with this word. There are plenty of people who do not identify using this word, but they're on the spectrum. They're more so involved in this community. It doesn't mean that they have to relate to the word. So beyond the binary, usually when we think of trans, we think, oh, you're only going to transition to be a male or female. But that's really a binary way of thinking about things. But gender is a spectrum. It's complicated. It's all over the place. So usually when people think about trans, they think that you're going to transition to a man or you're going to transition to a woman. But there are a whole bunch of people that do not identify with this binary way of thinking. And so people can identify outside this binary system that is neither man or woman. We don't have time for the video.
No.
But yeah, I just want to throw that out there because people do identify as non-binary, even though they may put male or female on the forms. It may not be an option to put on the forms. So even though someone doesn't tell you that's how they identify, but just know, just to respect them and to respect the name that they're giving you and to respect what they're telling you. Because even though they may put female, they might not identify as a female. So it's important to ask and ask what your pronouns are. They, them, theirs is gender neutral. So people would use that if I don't know someone's pronouns, I would use they, them, theirs because it's gender neutral and I'm not assuming their pronouns if I don't have the chance to ask them.
Are there any questions so far? Yeah, it's a lot.
Yeah, it's a lot.
But take it in as much as you can because this really what Tyler is highlighting is your capacity to build rapport in that counseling portion of what you'll be doing if you're doing any work with someone who's on the transgender spectrum, right? So, for example, there's already a lot of barriers for LGBT folk who seek healthcare in general. Things like being misgendered or things like being assumed to be like disease or to cause disease because of sexual behavior, things like that. So I'm telling you right now, the easiest way to lose or to not get buy-in from someone who's transgender or gender non-binary is by misgendering them or by assuming that because they look a certain way but they say that, it's some kind of like DSM diagnosis or something like that. What will help you in the counseling portion of building rapport with your client is to ask them how they identify and to really validate that. Yes, question?
Thanks. I'm sure it's different for everybody, just like everything. But is there a general rule about when and where it's appropriate to ask somebody what their pronouns are?
I would love for Tyler to answer that.
Anytime. I'd rather you ask before you keep constantly misgendering me and then I just shut down. Because a lot of trans people, some people won't tell you right then and there, but some people will. It just depends on the person. Because everyone's different. I know if someone misgenders me in class, I'm not going to correct them in front of like 20 other people. But I know if I'm talking to my doctor and they ask what are your pronouns, I'm going to let them know what my pronouns are. And if they keep asking, it's because they genuinely care and respect me and they respect how I identify. And I mess up sometimes. Like I'm not the perfect person, but just, if you make a mistake, correct yourself and move on. Because if you focus on yourself, then it draws the attention away from the person you misgendered and draws it back to you, which is not right.
And when you ask someone what their pronouns are, it tells that person that you understand that gender and sexuality are separate. So it'll be well received.
So transition, I think I really want to highlight this part because a lot of people think there's only one way to transition and that every trans person has to transition, which is not the case. Not every trans person wants surgeries, not every trans person wants to transition. There are many different ways to transition, and to assume that people are gonna have the surgery or they're going to wanna go through this or that just to be themselves is not the case because not everyone can afford it and not everyone wants it. So that's all I wanted to explain for that part. But we're gonna talk about socially transitioning since this is more focused on voice training. More so before I started physically transitioning, I wanted to participate in social transitioning. So I changed my name through the school, I used different pronouns. Bathrooms are really important because without gender inclusive restrooms, I wouldn't know where to use the restroom and a lot of people wouldn't know where to use the restroom. So it's important when you're advocating for LGBT, it's not only, same-sex marriage, yay, but bathrooms, like, I know a couple of states that are like, well, if it's on your birth certificate, then you have to use this restroom. But I know if I went into the ladies' restroom, I would get stares, I would get looks, and it wouldn't be a fun time for me. But that's what this is on my birth certificate. But if I can't afford to change those, then it causes a problem. So it's not just, just use wherever you want. It's, well, I have all of these things blocking my way to using the restroom, so why would I use the restroom? Which is sad, but it's true because all we want to do is just use the restroom. But people want to make a big deal about it and think, you're going to do something in the restroom. But it's like, no, like, if I want to do something, I wouldn't do it. But yeah. Sorry, it gets me so mad about it. Voice training, so even before I started physically transitioning, I wanted to change my voice, I wanted to be more deeper, things like that, and that's what's, depending on the person, it all depends on how high or low they want their voice to be. Joe, can I explain more on that, because that's your,
now?
Yeah.
Oh, okay, so that brings us to what Dr. KJ will enlighten us about is the voice training component. So Tyler is beautifully explaining this whole concept of transition. If someone is transgender, they may transition, meaning that they may redirect their gender expression so that it matches their gender identity, right? And part of that, a lot of times like in the media and, with people like, what's her name again? The Kardashians? Caitlyn Jenner. That media kind of made that seem like a one and done kind of surgery, right? But not everyone can afford. So transitioning, someone may do social transitioning, like name changes, pronouns, but ones that we often see in the media are like physical appearance changes, right? And then just some feedback from trans folk is like, they can do those things, make physical appearance changes, but there's really some frustration that when they go out, visually they're perceived that way, and maybe someone will approach them, maybe think that they're cute or something like that, and then as soon as they open their mouth and talk, that person sees a disconnect with their gender expression, how their voice sounds like the fundamental frequency, the pitch of it, and all of a sudden they're like, whoa, this isn't right, whatever that means, right? So the voice training component of transitioning is very, very important because it gives that person the confidence to know that when they communicate, and to all of you, you know how often people communicate and how important it is, that when they communicate, that it's not going to be a big deal about like the tone of it, but more of like, hey, let's go out for dinner, like the content, so something like that.
Also disclosing, like if someone discloses their identity to you, it means that they trust you with this information, that you're not going to like post it on Facebook like, hey, I met this trans person today, oh my gosh.
They exist.
Also varying their gender expression, not everyone can afford clothes that they want to have, not everyone can use the tools that they need to use, so just knowing that there's not one way to transition. And it's not a one-time thing, it takes years, things like that. So what is cisgender? Does anyone have an idea what cisgender means before I go?
I could be wrong, but is it like identifying like they're right in the middle?
Close. close. I know where your line of thought is going. Do you want to try again?
No.
Okay. Yeah. Behind you and then. Yeah.
When your gender identity matches your sex at birth.
Yeah. Is that what you were gonna say too? Yeah. That's exactly it. If we go back to the gender person, is that what you're going to say? Okay. Yeah. So I know this binary is listed this way. But basically what you said is that your sex assigned at birth, female, is in alignment with your gender identity, which is, I know what you were trying to say though, is woman, right? So cisgender, the root word means exactly the same. So the reason why we use cisgender is because we don't want to say if someone is born male and their gender identity is female, that they're transgender and everyone else is normal, right? The reason why we use cisgender is because if your sex assigned at birth is in alignment with your gender identity, you were born female, you view yourself as a woman, that you're cisgender, and that the other person is transgender and not transgender and normal, right? Very important.
This is a term that says, I recognize that trans people exist. So it's a very intentional term that demonstrates awareness, and I would say care, to say that trans people matter. So I know that when I talk to people and they say they're cis, they are recognizing me and they're recognizing everybody else in the transgender community.
My name is Angela Cristaldi. I identify as a cisgender heterosexual woman, and I prefer the pronouns she, her, and hers. I first heard the term when I was in high school. I spent some time on Tumblr. People were using the term there, and I wasn't really sure what it meant, but I knew it had something to do with your gender identity, but like I said, I was kind of confused about it. So I didn't really start identifying as it until my freshman year of college. I went to something called Safe Zone Training, which the school offers for anybody on campus. You can become certified, for lack of a better word, and you discuss gender and sexuality and how to make people feel welcome. A lot of the professors go through it for the LGBTQIA students so that they know how to make them feel comfortable and things like that. So I learned more about the term cisgender at that seminar, and I feel like that's really when I started identifying as that, because I think it's helpful to be inclusive of all people.
Do you think that identifying as cisgender is something that everybody should do to identify with their given gender?
I think after some self-exploration, they should at least consider it if they believe themselves to be an ally for the LGBTQIA community. It's a personal choice, and people should be able to express themselves regardless of what society thinks is accepting. Nobody should have to be afraid of being who they are.
Sponsored by Pfizer.
Right.
Okay. So cisgender privilege. I'll let Joe talk about cisgender privilege.
Okay, I got a lot of it. I have cisgender privilege. So is privilege a term that everyone's familiar with? It's more of a societal construct. I'm also male, so I carry privilege over women. I'm cisgender, so I carry privilege over men. I'm gay, so straight people have privilege over me, right? So that's kind of what we mean by the word privilege. Because my sex assigned at birth is in alignment with my gender identity, there's a lot of things that I take for granted that, and I'm sorry, I'm going to use it as an example, Ty, that are things that Ty has to actually think about. So for example, using the restroom, cisgender privilege is whenever I have to pee, I can go to the bathroom, and in this building, I never have to wait, and I pee, and I'm done. For Ty, and he can validate his own experiences, but it's not as linear as that. There's a lot of more thought that goes into just using the restroom, and really sometimes that goes towards safety. And when your safety is at risk, it's a totally different experience. So I'm just going to read some bullets. So part of cisgender privilege is not having to worry about being placed in sex surrogate facility that is incongruent with your identity, is what we just talked about. not being required to undergo extensive psychological evaluation in order to receive basic medical care. So for some trans folk, when they seek basic healthcare services that I go to seek, I have no problem because I'm cisgender. But if someone's documents or like their birth certificate or something like that says a different sex assigned at birth than what they're currently presenting or identifying as, some healthcare professions may ask like, well, where's your diagnosis form that says you're trans? Because it's not in case anymore, right? It is?
Yeah, because I have to be
Okay.
diagnosed to get hormones.
Okay, so it's on the Diagnostic Statistics Manual, which is in alignment with a lot of the other diagnoses that we learn about in our field. So it's in that same book, right? Cisgender privilege is stating your name and people believing you. I say my name is Joseph, everyone's like, cool. But if I were trans and I said my name is Kimberly, people are like, no, it's not. Like, what's your name
Like,
though?
what's your name?
What's your real name? Like, yeah. So, and we introduce ourselves all the time. Cisgender privilege is being able to assume that everyone that you encounter will understand your identity and not think you're confused or misled. Same thing, like, you know, I go into the room, I say, hey, I'm male. They're like, oh, cool. You didn't even have to tell me because I assumed that about you, right?
But if I go into the room and I say I'm male, people will be like, but your chest, and it's like, well, does it matter?
Yeah.
And also, if I wanted to find a doctor, I'd have to do extensive research on seeing if they're a trans-friendly doctor because they can deny me my basic medical care because I'm trans, or they could not want to see me because I'm trans. Yeah, it's a lot of things that we have to think about on a daily basis that a lot of people often take for granted.
Has it gotten any better?
No.
I'm just curious, because
No.
there's so much talk about, you know, healthcare covering.
It honestly depends on what state you live in too. Fortunately, we live in California where it's pretty progressive.
Yeah.
But even then in other states, a lot of trans people have a hard time finding healthcare, having access to hormones and things like that.
So it hasn't come.
Yeah, it's still
People are
pretty.
putting out there. Okay.
Yeah. But yeah, that's why y'all are learning
Yeah.
to help improve this, and that's why I'm doing what I do. But yeah, cisgender privilege is important. It's important to recognize that you have this kind of privilege. Because I face different challenges on a daily basis that people may not notice. Like, if a professor has their sign-in sheet on the PowerPoint and my birth name is right there, but I identify using a different name, I wouldn't want to tell, oh yeah, this is not my name, but then it's different than my birth name. Then it gets really weird and students are like, I'm confused, and the professor's like, I don't know what to do with you. So it actually happened, so it's not like I made it up, it actually happened. But it's a lot of things that we have to deal with. So if you want to learn more about cisgender privilege, you can go visit us at the Pride Center and learn more about your privilege and things like that. And you know, your language matters. Don't assume you know someone's gender. Don't use gendered language when needed, especially when you're saying like, oh, hi sir, hello ma'am, things like that. Not everyone identifies like that, and you may misgender someone incorrectly by using those terms. As you can see with the comment, it says, I felt really cute today until, and the person's like, thank you sir, and she knew it was bound to happen occasionally, but I underestimated how invalidating it would feel. And she's thinking if she should say something in her head, like, should I tell him that I don't identify as a male? And then in the third one it says, is that how people see me? Are they just humoring me? I need to grow thicker skin. And the person says, have a nice day. And so that happens a lot, even though people think that they're trying to be nice and that they're trying to, you know, have people have a great day. But what they don't know is that it may harm someone and how it hurts their feelings and it validates how they identify by using improper language and things like that. You know, be sure you ask what they want to use, and a lot of times people don't use correct forms. It just says name. But in that instance, I don't know if I should put my legal name or my preferred name. So sometimes just having preferred name on there, it helps people know that I want to use this name and not this name. Because the instant someone uses my legal name, I shut down. I just like, no, I don't want to deal with you. I don't want to be here. So it's important to let people know when they walk in. If the preferred name isn't an option, asking what name do you prefer to use, or what name would you like me to use. Because I know when I went to my therapist, that was an option, and I was automatically misgendered, and I did not want to speak to a counselor. And then don't engage in microaggressions. We don't have time for that. But a microaggression would be, why would you transition if you're going to be gay? Your voice doesn't sound manly today. Are you detransitioning? Things like that. Little things.
When we first opened the Pride Center, we had a student on our team named Cadence Valentine, really great trans advocate leader, identifies as trans themselves, and we had a student summit that day, like a U.S. University Student Union wide training, and they were simply just washing their hands in the bathroom and could hear people in the stalls like commenting like, "There's a dude in here," and like, "Why are they in here? I'm gonna tell my supervisor." Just like, so those are just examples of some microaggressions that people may face.
Ally is a verb, it's not a noun. You can provide support in little ways than you realize just by asking what are your pronouns, and educating yourself on our issues, and just continuing to educate yourself, because it's not only, oh, I can't go to the bathroom, but people are being denied housing, people are being denied jobs. That's how often a lot of trans people are involved with sex work, because they have no other option to make a living. Also, if someone's being transphobic, say something about it, because that's how it leads to murders. Like I believe,
I forgot the statistic too. But there's a very alarming statistic that I believe it's minutes.
Like every 2 minutes or something.
Yeah, every 2 to 3 minutes, a trans woman of color is murdered. And I think there's already a number so far for this year, and we're only in March.
It's above 20, that's for sure. And our community is already small enough, so even just having 20 is just like a lot. But you can speak out against it. Like if you're someone being transphobic, or saying, "Oh my gosh, there's a man here," or like speaking up. Like if you hear something that's just like, that doesn't sound right. Like why would you say something like that? Or even if you hear someone talking about Caitlyn Jenner, but using her old name, that's transphobic. Things like that. Using the right pronoun, name, term, and not policing public restrooms. Like if you see someone use a restroom, let them use a restroom. Don't say you can't go in there. Things like that. Or if you know any gender inclusive restrooms, let them know where those restrooms are too, because even on campus, it's like a mission trying to find gender inclusive restrooms. Even though I shouldn't have to go all the way across campus just to use the restroom. But I do. Make sure you keep confidentiality, don't out people. Not everyone's okay with them knowing, with you knowing their status. Not everyone's okay with being out and trans, because it's pretty dangerous. Especially like times like these, it's pretty dangerous to be trans and to be ourselves. So it's important that you don't like tell the world, "Oh my gosh, this person is trans," or like if you're in class and you're like, "Oh my gosh, this trans person," let me talk about their whole life story and state their legal name and things like that. Like that's not okay. So yeah, just a couple of things here and there, and just we can have some more things about you in our life.
And you know, even how often I show up for the trans community, and how often I work with the trans community, I will never call myself a trans ally. I will only allow people who identify as trans or non-binary to call me an ally, because it's not my place to say, "I do so much, so I'm a trans ally." I will let Tyler tell me that. I will let other folks tell me that, because really, that shows me that they value how I'm participating and showing up for the trans community. But yeah, it's exactly what Tyler's saying, that allyship is a verb. As far as like things that you can do is like show up to events. Every year, CSUN has a week-long Trans Awareness Week in November. It's a series of events followed by the Trans Day of Remembrance, which is every year on November 20th. And really, it's a celebration, but mostly it's to honor the lives of trans folk who have passed on or been murdered. And it's really to show solidarity for that community. And that's an example of something I'll do. And I always introduce myself with my pronouns.
Any questions? Don't be shy. Sweet. Okay. Sorry, we're longer than fast.
But thank you for listening, y'all. I know it's a lot to grasp, and then oftentimes like the feelings of people who go through these kinds of presentations, they're like, well, like what can I do, right? And it's okay to feel that way. We'll give you like 2 or 3 tidbits. Like definitely one thing, always introduce yourself with pronouns. If you're not sure what someone's pronouns are, ask. It's not so much a problem now, but if someone needs to use the restroom, telling them where gendered restrooms are, but then also telling them where gender inclusive restrooms are as well. On every clinic floor now, we have gender inclusive restrooms, which aren't really gender neutral restrooms, where like multiple people can come in. They're just another way of saying single stall restroom. So, yeah.
The gender inclusive, I only know the one in the wellness center.
Yeah. Perfect.
Is that the only one?
That's the only truly gender neutral restroom on campus. So I was a student working with the USU before the fruition of the Oasis Wellness Center, but that was one of the initiatives. There were surveys put out, and we got student feedback about how they would feel about having gender neutral restrooms on campus. And it's funny because there's so much talk about gender neutral or allowing trans folk to use the restroom that they identify with. And we're looking at the Oasis because I'm staff with the USU, and it's like there's been 0 instances of harassment, 0 instances of complaints. The only thing that ever happens is like people who are super kind of like super cis, super transphobic, they just don't use that restroom because they're uncomfortable with the idea. But it's like, hey, we just gave access to gender non-binary folk to use a restroom. It's just a pee, like I just want to pee, please. But it's beautiful. If you haven't been, y'all pay for it anyway out of your tuition, so you might as well go and get a massage and pee. So you go in and like there's the initial room is all just like places to wash your hands. There's lockers, things like that, and then when you go into the next room, they're kind of like the Nordstrom bathrooms where it's like floor to ceiling doors, and it's beautiful. So check it out. Any other questions? Anything you want to add, Ty?
Just be respectful. That's all I can say. Like, if I know someone's being sincere and being honest and really wants to learn and really wants to be an advocate for the community, I'd let them in. I'm not gonna shut anyone out who wants to learn. Like, if you use my pronouns wrong, it's fine. Just correct yourself. Like, as long as I know they're being honest and true with their intentions, I'm willing to open up how my experiences, and I'm willing to open up about what I'm going through. So that's the main thing. We're all human.
Also, sorry, really quick, you won't only find trans and non-binary folk for people who seek voice training. People who are non-binary or trans may seek services for fluency. People who are non-binary or trans may seek services for aphasia, anomia therapy, things like that. They literally can come into any one of those services because their gender identity isn't all they seek medical attention for. Does that make sense?
Mm-hmm.
So just open your mind up to it. The Pride Center has a plethora of resources that you can have. We have a transgender services tab on our website, so you can get my card or our pamphlet here. Just to share with you some things that are on the table. We have 2 healthcare related services, the LGBT Center in Los Angeles and then St. John's. We also have social stuff, so how you can be an advocate for the LGBTQ community in general is by showing up. So we have 2 social programs. We have a coffee night every Thursday, so if you want to get coffee before class, you can totally stop by, it's fine. And then on the flip side, we have a karaoke night once a month, every Wednesday. We need to collaborate with NISA. And then what Dr. KJ and I are wearing are these really cute pins. It says, hello, my pronouns are, and then there's space for you to write with Sharpie or pen and label maker, he, him, his, she, her, hers, Z, here, here's, all the different, ones that you did. Yeah.
What the last one you said, what were those exactly?
I'll let Tyler. Z, here. It's gender neutral.
Okay.
It's just more
So is it
options.
like they?
Yeah, it's just like they them theirs. You use them in the same context.
Okay.
Yeah. If you don't know someone's pronouns, what I do, if I haven't asked or they haven't told me, I always just say they, them, theirs. I know grammatically it sounds a little weird because they kind of sounds like a group of people, but like I never met you before, so when I talk about it, I'd say they have pink shoes, they have a pencil case on their desk, and they are happy to be here, right? Stuff like that. Z, here, here's are for folks who know a lot about gender identity, and when you introduce yourself with pronouns she, here, and hers, you're also informing that person that there's more of like a activism standpoint behind your pronouns, and that you're really challenging the gender binary by adopting pronouns that have been created to challenge the gender binary. Folks who don't identify as he or she may use they, them, theirs, or they say, just use my name. My pronoun is my name. Yeah.
I have a question.
Yeah.
I'm bilingual, so do you know how does it work in Spanish?
I know.
Oh, okay.
Yeah. A lot of people just use L. That's mostly from what I've heard from people who use Spanish. They use those pronouns.
Okay.
Oh, okay.
Got it.
Yeah, my mom is, well, my parents are from the Philippines, so I used to get so mad every time she would call me she, but it's because the language transfer, there's no gender pronouns in Tagalog, so when she learned English, you know, it's like she'll just she, and I'm like, I'm not she, and I'm cisgender, and I get so mad when my mom calls me she, so I can only imagine, like, you know, for folks who are more aware of their gender identity, how frustrating that is. So, as far as language transfer, even if you're fluent in whatever language that is, explaining that concept in that language to them, so they can say it back to you in that language of how they want to be referred to.
Right.
Yeah.
Okay.
Because it might not be a pronoun. They might just say, "Well, use my name," something
That's
like that.
Safest way to
Yeah.
Okay.
Yeah. That's a really great question.
Cool.
I'm so sorry we used it.
No, you're good.
Okay.
Yeah,
Okay.
thank you so much.
Oh, we got 6 people watching now. This is good.
Yeah, I'll take care of it. Okay, I need
Folks have, many people have already had 661 or There's a lot of you here. Okay, so all right, so then this would be information for a lot of people. So we're going to be talking about communication training, voice training for the transgender. Oops. I should have had coffee. There's a great text, Voice and Communication, Therapy for Transgender and Transsexual Clients. Adler, 2004, there's a new version out now. But it's a really great book, and they're out of Syracuse. They have a wonderful center there for training. A lot of the groundbreaking work in this area. Okay, so some of you discussed transitioning socially when somebody decides to make the transition physically. There's a team. We can be part of that team, and often are. Excuse me. So there can be a lot of people involved, or if it's a social transition, then these people will not be involved, right? But you might find yourself working with a team. Of course, with where we are right now in this country, it's hard to say what's going to happen with insurance and coverage and that sort of thing. So, you know, it seemed like things were going more in this direction with more insurance coverage for these services. I don't know what's going to happen. A lot of us don't know what's going to happen. So, but a lot of times speech and voice is covered. Sometimes it's not. Again, probably depends on the state you're in, on the plan you have, and that sort of thing. So, but what is our role as speech language pathologists in transgender voice and speech training? So someone comes to us and wants to work on voice. You want to do
voice and speech assessment. The reason speech is up there is because it's not just voice. Voice, yes, is primary, right? But just altering the pitch of the voice is often not the only thing we're gonna work on. And sometimes it's not quite enough. We're gonna change some other things, shift them. So voice and speech assessment, voice, speech, and language training. There are differences in speech between across gender. There's differences in language, in vocabulary, in word choice. I found this thing on the internet about a month ago about the most common 10 words that females know that males don't know, and that males tend to know and females don't. So it was just kind of interesting, but it got me thinking about vocabulary and the language aspect and how we use language and syntax and articulation and all those things, and how that can vary across gender. Okay. Counseling, but only in those areas that are within our scope, right? And appropriate referrals as needed. But for the most part, I'm going to be talking about voice and speech assessment and training. Okay. Okay. It's really important. You know, in our field, transgender communication training is fairly new. Okay, it really is. 10 years, 15 at the most, and that's probably stretching it. So in our field, this is fairly new. Do we have efficacy studies? We have 9. Are they level 1? Those of you who have had research and with Dr. Sinclair, you know what level 1 is? Does anyone
Yes.
Tell me what level 1 is?
First-hand research.
What's that?
So level 1 is first-hand research. So the researcher is doing the research, and there is a control group,
Right.
and it's
Yeah,
It's
there's a
randomized?
control group.
Randomized.
There's right, right. So, you know, in our field, especially in voice, I think Lee Silverman voice therapy is really the only therapy I know of that really has really good repeated level 1 research, right? Where there's a control group and that sort of thing. So we only have 9 efficacy studies in this area, and they're not level 1. Okay? But it's a start, right? So we always want to know, is what we're doing working, right? That's kind of important, right? So the importance of a gender-congruent voice relates to its impact on psychosocial and financial well-being and personal safety, right? Because as Joseph was saying earlier, and I've had clients tell me this, it's fine until I start to talk. And that puts their safety at risk, to be perfectly honest, so, among other things. So, you know, while a gender-congruent voice positively impacts the individual's self-identity as woman or male, a gender non-conforming voice not only impacts negatively on their self-identity, right, but holds the potential to betray the individual's birth-assigned gender and attract significant negative societal reaction, right? And that's kind of falling off the screen. But, basically, it's saying, right, this is important, and we need to be aware of it, and we need to work with it, and it's down there somewhere. Okay. So, for those of you who've had grad voice, some of the assessment is very similar, but there's a particular slant to it, right? But some of it's going to be very similar. We're going to want a voice history, and I'm going to talk a little bit about what that entails. A medical history, and what that entails, and why certain aspects of medical history are important to voice, right? Because don't make the assumption that the person coming to you for voice training has never had a voice problem in their life. Okay, they might have, right? They might have reflux, they might have pharyngeal reflux, they might have had nodules. Who knows, right? So they might have muscle tension dysphonia, which is a problem with the voice due to excessive muscle tension, okay? So you don't know that, right? And so you want to take a voice history, a medical history. Do they have reflux? Do they have allergies? All these things could affect the voice. We want to rule out any pre-existing voice problems that are unrelated to the transgender voice issues. We want to know about their vocal hygiene, which I'm going to be talking about in a moment. We want to assess for muscle tension. We want to assess breath support. And we're going to talk a little bit about what all these things are. So voice history, yeah?
The hormones, do they affect the voice at all?
With a female to male, transgender, if they are taking hormones, then yes. Oftentimes it will lower the voice, but it doesn't go the other way around. Right, so estrogen does not raise the voice. There is a physiological, anatomical difference, right, in the vocal folds. If you are identified as male at birth, if that's your biological sex, your vocal folds tend to be longer, they tend to be thicker. If you're female, they tend to be shorter and thinner, right? So we have that difference to work with, and I'm gonna talk about how we work with moving the pitch around. But with female to male, a lot of times the hormones really help and lower it. So it shouldn't be surprised that the ratio of male to female clients that we see is almost twice, almost, not quite, female to male clients. And so we work a lot more with voice feminization than we do with masculinization. So we want to know, how do they use their voice during the day, right? Do they use it for work? How do they use it socially, right? What kind of environments do they speak in? Do they have to be loud, right? Do they have to project over noise? Do they go out to noisy restaurants a lot, right? So we want to know how they use their voice, how many hours a day do they use their voice, right? Because if you're going to be manipulating someone's pitch and vocal quality, right, you want to know how they're using their voice, because certain things may translate well, or some things may not translate as well to being, for example, being loud, right? Most of us, when we want to be loud, will raise our pitch along with our intensity. If you've already raised somebody's pitch, right, their home base, right, for voice feminization, being loud, they might tend to bring it up even more. Now, whether or not that's safe or how safe that is, we want to kind of keep in mind. So it's not just a matter of adjusting their pitch, it's seeing how that pitch fits for their voice usage and what they do, right? And getting them to use their new voice or the voice that they're desiring safely. Okay. So we want to know how they use their voice, the amount, the type of voice usage, environments. Do they have any prior voice problems, any history of voice problems? Their current voice challenges or problems, right? So what are they struggling with right now? And actually, this is a transgender survey.
Someone for you forgot my backpack. Kind of need it for tomorrow.
Bye.
This is a voice survey, so I'll kind of split these guys in half and pass them around. So there's 5, 6, 7, 8, 9, 10. Yeah, should be enough. But it'll kind of give you the idea of the kinds of things we want to know about their voice usage and current voice challenges and problems they're having. If they're trying to raise their pitch, if their voice fatiguing when they do that, you'll have an idea. Should you Okay, so as they're going around, but things like people have difficulty hearing me in a noisy room, my voice makes me feel less feminine, my speaking pitch is too low, the pitch in my voice is unreliable, and as you go down, you'll see that, my voice fatigues easily, right? So a lot of different questions. I use a great deal of effort to produce my voice, my voice gets tired, etc. Right? So, what?
Do you have more, Dr.
Oh, that's fine. It's in the book.
One or two?
We're okay. We got it.
You got it?
Yeah.
Okay, good. So we want some idea of what are they dealing with right now, what are the challenges, what are the struggles, right? And what do they want to achieve? That's also something we want to know. What do they want to achieve in voice training? What do they want to get to, right? Do they have any singing or speaking voice training? Doing singing training can be challenging. If you're working with male to female transition, you are still working with a biological male vocal range. And I can tell you I've had a few clients and it's challenging to get the voice to sound feminine. And the research on that and some of the articles just coming out on that is brand new. So that's a dance that singing voice specialists or SLPs or singing voice specialists are really just starting to do and learn how to work with those clients who are transgender and singers and who, you know, their gender identity is female and they want to sound like a female singer. And yet we have the anatomy that we've got to somehow dance around. And that's can be kind of challenging. Medical history relevant to voice. And I'm big on educating and telling people why I'm asking them the questions I'm asking. Right? So I want them to know, I want to know about their medical history, not because I want to know about their medical history, but because I want to know about the things that might have gone on or be going on with them that are going to affect their voice. And one thing is acid reflux. So acid reflux can come up, it can affect the vocal folds, it's a burn, it's an irritant, makes them swollen, makes them edemic, right? Makes them sore and unhappy, right? Allergies, if someone has uncontrolled allergies, it makes the mucosa of the vocal folds dry. They don't vibrate as easily when the vocal folds are dry, they're not happy, they don't vibrate very easily, they can make us hoarse, right? Sinus problems, postnasal drip, irritant to the vocal cord, right? Surgeries to the neck, throat, oral cavity, or palate, right? Any of these surgeries might affect the voice, depends on what's going on, right? You know, for example, when they do cervical spine surgery, they typically do an anterior approach, they make a cut, they pull the larynx over, literally pull it and move it over, and then they go in and do their work on the cervical vertebrae, which is usually screwing them together or putting a cage in there, and then everything goes back. 60% of those folks have a voice issue for about 6 months afterwards because the recurrent laryngeal nerve, right, which you guys who are undergrads who had 442 probably less long ago, right, than everyone else, the recurrent laryngeal nerve serves all the muscles of the larynx except the pragothyroid, which is your pitch-changing muscle. So if it's injured or compressed from all the swelling from that surgery, it might not be functioning right. You might have a weakness in one vocal fold on that side. So, you know, we want to ask about these things. Respiratory disorders, asthma, COPD, emphysema, any respiratory disorder, and why would that be important to know about? Someone who hasn't had one. Crystal. Yeah, breath support, right? Okay, you need adequate respiratory drive to get the vocal folds vibrate, right? So they need to have good breath support. Right? So we want to know if there's any of this going on. Back or neck injuries, right? Remember that your larynx is hanging from the hyoid bone, right? And your hyoid bone is what? What's unique about the hyoid? Right, it's the only bone in the body that's not attached to another bone. So all of your suprahyoids attached to it, right? And they course either to the mandible or just points on the skull. Your infrahyoids attached to it, right? They actually originate down in this vicinity and course up. So your larynx is literally hanging in your neck by a hyoid bone and pretty much at the mercy of all the extrinsic laryngeal muscles. Right? So if there are neck issues, tension on one side of the neck, it can affect the larynx. And it's not unusual to see people with muscle tension dysphonias because of tension in the neck. And if someone has been trying to raise the pitch of their voice themselves, right, and they're kind of going, I can't really, trying to raise my pitch without going into falsetto. They're really too high, so I'm doing this and like right now my hyoid bone is really, it's like right up here, and I can feel all this tension on the floor of my mouth, and it's really not very comfortable, right? So if someone is trying to raise their pitch themselves and going too high, they can get fatigued. And so we want to know about neck injuries or back injuries or any problems with neck tension or back tension. You guys are all familiar with the fascia in the body and concepts or treatments like myofascial release. Okay, your fascia kind of is all over your muscles and it pretty much connects everything in your body. Well, research has shown that fascia can get tight as well, which is why sometimes when you get a massage, you feel great and then it comes back. because the issue is the fascia, and the fascia needs to release and relax. So myofascial release is something you'll hear a lot about in relation to not just voice, but also swallowing disorders now, right? So my point being that if they have a back injury, and because fascia is connective tissue, right? You know, something that is affecting the lower back can actually affect the cervical vertebrae and the larynx. It's not impossible. So we want to know these things. Neurological disorders, right? They can affect the voice as well. So I will always say, I'm going to ask you some questions about your medical history, and here's why. Because I want people to be comfortable with why I'm asking. Okay. Local hygiene. This is really, really important because it's directly related to the health of your voice. So I want to know from the get-go, before I even start training, what their vocal hygiene is like. Do they drink enough water? Okay. Are they well hydrated? Your vocal cords are covered with mucosa, right? There's a mucosa, or what we call the cover. And it's basically, I like to describe it as Jell-O covered by saran wrap. So you have the epithelial tissue, which is the saran wrap, and the Jell-O, which is that. Did the undergrads learn about layers of the vocal folds? Did you guys learn that? Okay, cool. All right, superficial lamina propria would be another word for the Jell-O, okay? It's got to be, the cover has to be in good shape with mucosa. It has to have enough lubrication, enough thin watery mucus so that when the folds collide, they're not sticky, right? And the lubrication, that thin mucus acts like, well, a lubricant, right, during vibration. So if your mucus is sticky, it's a long day, thick and sticky, right, then it doesn't help with the vibration as much, right? So water intake's really, really important for everybody. Caffeine intake, we want to know how much caffeine. Caffeine's a diuretic, tends to dry things out. We want to know if they engage in frequent yelling, screaming, loud talking, okay? Frequent untrained singing, throat clearing, coughing, smoking, hard low attacks, allergies, reflux. All of these things can adversely affect the mucosa of the vocal folds. Okay? I had a client who was a transgender client who was always coming in hoarse and would always be fighting with their partner. And so they fight, and this person would scream and yell and come to voice training with a voice I could barely work with. You know, when you've got swelling in the vocal folds, how can I bring the pitch up when swelling? If you've had laryngitis or a cold, what happens to your pitch? Goes down. Okay. So I'm working with vocal folds that are swollen and unhappy, and you know, it doesn't make for a very productive session. So when we're working with people with voice training, we want them to understand the importance of vocal hygiene, right? Because they're going to come in for training. We want to be working with a voice that's healthy and in good shape, right? Otherwise, it can be difficult to get those changes, right? Throat clearing, which I'm being a really bad example of tonight, and I just did, right? Constant slamming of the vocal folds. So it's worse than because you're vibrating and coughing, so the collision forces are high. Chronic throat clearing, chronic coughing can cause swelling of the vocal folds. Smoking, that should be a no-brainer, that's an irritant, right? Does everybody know what a hard glottal attack is? Yes. So instead of saying apples, apples. Did everyone hear the difference in the onset? Apples, apples. When you produce a hard glottal attack, the folds slam together, right? And then they're blown apart rather violently, okay? So pervasive hard glottal attacks are not good things. And this is something we're going to want to train out of somebody, for sure. Okay? So we want a good vocal hygiene history. We want to educate about vocal hygiene. Muscle tension assessment, okay? If someone's been working on their own to try to elevate their pitch, or perhaps even lower it on purpose, okay? If I'm going to lower my pitch and try to sound deeper, I exaggerate it, right? I'm actually lowering my larynx. I'm really trying to hold it down here so that my vocal tract is longer and I've got this deeper timbre, right? Because I could go, I'm not changing pitch, I'm changing the shape of my vocal tract, right? But if you're holding it down all the time, then those muscles can get rather tight. Likewise, if you're yanking up the larynx, trying to speak too high and the larynx is elevating, again, you're gonna have muscle tension. So we're going to palpate the floor of the mouth, base of the tongue, the masseter muscle. We're going to palpate the larynx, right? We should be able to find the thyroid membrane. We should be able to get a finger in the membrane and one above, right? Okay, in somebody whose larynx is very elevated, you might find the hyoid bone is rather high and tucked up in here. Right? You should be able to kind of take your finger and go right back to the hyoid. So when somebody's been working on their own, sometimes they do fine, sometimes they get themselves into trouble with muscle tension, right? So you want to assess to see if there is any, because you'll want to, that is something we will remediate, right? We want to get rid of the muscle tension. You should be able to lateralize the larynx fairly easily, kind of wiggle it back and forth. Right? If you can't wiggle it at all, then there's some tension in the pharyngeal constrictors, or what we call the ringopharyngeal muscles. You're going to do all this at rest when they're not talking, but you're going to do it again when they are talking. Because sometimes people don't show muscle tension at rest, but the moment they start talking, you'll feel it. Right? Assess for neck and shoulder tension as well. So it's not just a matter of jumping in there and changing somebody's pitch, is my point, right? You want to understand their mechanism. Is there muscle tension? Is the breath adequate? How do they use their voice? What's their vocal hygiene like? Have there been pre-existing problems, right? So it's not just jumping in and training the voice and shifting the pitch without doing the assessment first to see where they're at. Breath support. Are they an abdominal breather? Right? You see the abdominal wall moving when they breathe in. Abdominal thoracic, where they have abdominal breath plus lateral thoracic breath movement, or are they clavicular? Right? They're breathing up here. Okay? We need adequate respiratory drive. And clavicular breathers tend to take little breaths, and that's usually not adequate for voice production, especially if your client has high vocal demands. Say they teach, or they're a telemarketer. Right? Somebody who uses their voice all day really needs a good breath support. Right? You also want to pay attention, do they speak too long on one breath, right? Do they take inadequate breaths? Do they hold their breath before speaking? I had a client who just breathed clavicularly all the time, and we needed to get to abdominals so that elevated pitch voice had the support it needed. Otherwise, there was too much tension. And the voice sounded shaky. It sounded insecure. Right? So having the breath is important. All right. When we do a voice assessment, we typically measure acoustics of the voice. When you're doing voice training for the transgender client, you're interested in their habitual pitch, their optimal pitch, their physiological pitch range, right? What's the lowest note they can produce? What's the highest note they can produce? I'm going to get to that in a second. So we're talking about either bringing someone's habitual pitch up or bringing it down. So we need to know their physiological pitch range, which is right, how high and low they can go, to know kind of what's safe, right? The other thing is that not all biologically male voices or biologically female voices are the same, right? If we look at the female voice, there's sopranos, there's altos, there's contraltos, there's first sopranos, there's second sopranos. For males, there's baritones, there's basses, there's tenors, and if you are well versed in classical music, there's at least a half a dozen kinds of tenors. Right? So within the biological sex, there's going to be different voice types with different physiological pitch ranges, right? So a bass voice or baritone voice is going to have usually a lower bottom note than a tenor. Okay? Not always true, but most of the time. So we want to know their pitch range, because we're going to be tweaking that habitual speaking pitch, and we want to know how much can we lift it, how much can we lower it, what's really safe, right? Spectrogram. You guys remember what a spectrogram is? Right? Does anybody not know what a spectrogram is? Anybody want to admit that they don't know. I wasn't aware when I asked that question. If somebody doesn't know, it's not raising their hand. But it's sort of a fingerprint of the sound, right? You've got frequency on the y-axis, time on the x, right? And who remembers what vowel formants are? Anybody? Vowel formants? Hillary.
They're they determine what the vowel that you hear, the perceptual quality of the vowel. The first
They
thing,
do.
they relate to your vocal tract shape as well.
Right. So formant frequencies reflect the vocal tract shape. So your vocal cords vibrate, there's the fundamental frequency and the harmonics. The vocal tract shape is either going to amplify certain harmonics or attenuate or dampen others. And what gets amplified and what gets attenuated depends on the vocal tract shape. So if I'm going the only reason you can tell for me is because I'm changing the vocal tract shape by changing my tongue, which changes the formant frequencies. Well, formant frequencies for the female voice are higher. Okay. So because typically the female vocal tract is shorter. You have a shorter tube, you have higher formant frequencies. So we can, to some extent, tweak the formant frequencies a little bit and change them. But we especially want to look at their corner vowels, E, A, U, and A. Especially E, because we're going to E-ify for the male to female transgender. We're going to E-ify a lot of the vowels, which I'll talk about what that is later. Intonation, we want to know what's the inflectional pitch range. So if you've been to the voice lab for a voice eval, we've had you read the rainbow passage, and we figured out your habitual pitch. But what also shows up on that little window that pops up on the computer is what's called inflectional range. So it gives you a readout of what was the lowest pitch you produced while you were reading, what was the highest pitch. Females tend to have a greater inflectional range than males. For a female, it might be 18 to 20 semitones. For a male, it might be 10 to 13. So we want to get an idea of what their inflectional range is, because we might want to try to stretch it a little bit. Okay. So these are the important measures you want. Habitual pitch, try to get an idea maybe of their optimal pitch, where their voice might function with the greatest ease, their physiological pitch range, a spectrogram, especially those corner vowels, and their inflectional pitch range or intonation range. Because these are things we're going to be working with and trying to shift a bit. Okay. I'm going to talk about treatment in a second, or training in a second. Articulation assessment. There are differences between female and male articulation, speech articulation, right? There's a difference in vowel durations. Women tend to lengthen their vowels. The durations of vowels are longer. Women tend to articulate more lightly, but with more precision, interestingly enough. And we're going to assess speech rate and intensity, which also varies by sex. We want to listen for hard attacks on vowel initial words, those hard glottal attacks. I'm not going into everything. I'm just going to mention the things you should look at, the things there are differences for, that you want to attend to. Okay. You might want to look at language, syntax, semantics, pragmatics, discourse, nonverbal communication. These all vary by sex, right, in communication. Okay. So let's talk about training. We're going to make speaking pitch adjustments. We're going to look at conversational pitch range and inflection. So when we have a client who has a female to male transgender transition, if they're taking hormones, many times the voice will lower adequately enough. If it doesn't, there are surgical procedures to shorten vocal folds a bit, but sometimes they end up creating more flaccid vocal folds, which although they vibrate at a lower frequency, they often have trouble getting complete closure. So sometimes it results in a weaker voice, but voice training can help to strengthen it. We want to establish more of a chest resonance, so a little more chesty, so bringing the resonance a little more down here. But again, we don't want to pull, right, the whole laryngeal sling down. Right? And like I said, pretty much at least in my experience, I've had all male to female transgender clients. I haven't had any female to male that were seeking services, so, there's definitely more common one than the other. A yawn side technique can help lower the larynx, right? You yawn, if you just put your hand on your larynx. A yawn, you should feel it drop down, right? Everyone feel their larynx drop down, hopefully, right? Okay, so that can help achieve a lower laryngeal posture. You lengthen the tube, you get a darker timbre potential, right? More of a chesty timbre. But we don't want them to sound artificially down and back, right? We don't want that sound either. So we do want sort of a balance between chest resonance and some resonant voice in the oral cavity as well. So training for the male female transgender clients, we are going to work with tweaking the habitual pitch, right? Adjusting it. So we're going to call that speaking fundamental frequency. So SF sub 0. So our goal is to achieve a gender ambiguous pitch without strain, without muscle tension, a pitch range that will pass, right? But one that's not going to cause pain and discomfort and straightening stress. There is a gender ambiguous or gender neutral pitch range, and it's from 155 to 185. Okay. So you're probably wondering, what does that sound like? There's always an outlet there. In every other meeting, I was going to play that for you. I think that'll work. Just looking at the frequencies really doesn't mean anything to you, does it? I would guess. That would be my guess. So that's 155. That's about 185, right? So what we want to do when we're training is usually starting around that E flat or D, if they're a lower voice, humming, chanting, getting a forward focus, right? Like mean. I mean, that's really low for me, but I'm so tired that I can do it today. So, mine, right? So it's a forward focus. If you just, let's take this pitch because I think everyone can probably hit it. So, just hum it. Make sure your teeth are not touching, just your lips slightly touching. Your lips buzzing a little bit. You should feel buzziness. So right now, we're going to chant You should feel a lot of vibrations, lovely. You should feel a lot of vibration right up here, right? You feel that buzziness?
Mm-hmm.
So now I want you to go moon.
Moon.
Right? So we start with simple chanting, simple humming to train that forward focus, right? And we might, start here, go up a half step, go up a half step, go down, right? So chanting, moving to words, maybe chanting things like the man in the moon, nearly 9, nearly 9, and then keeping it in that spot, right? And monitor, always ask, how does that feel? Do you feel any strain? Is your voice getting tired, right? Because we want to get an idea of, is it comfortable for them, right? So if you're talking semitones, 1, 2, 3, 4, you're working in a 4 semitone region, which is pretty narrow, but you can expand that a bit, right? And again, it's going to depend on the individual. If you have somebody with a bass voice, a very low voice, right? Let's say that their bottom note is this. Can anybody get this in here? Right? That's pretty low, okay? And, you know, if you're shooting for that F sharp, well, that's almost an octave, a doubling in frequency from their bottom note, okay? That would be like me, so kind of talking here. So if I'm talking here, then I really am straining and it's sounding kind of pinched and tight and basically uncomfortable for me to produce and for you to listen to. Okay? So you want to, that's why you get the physiological pitch range, right? Because you want to make sure what you're targeting is reasonable. Okay? So, you know, that might be a little high. So maybe you start them around D or C sharp and move up and train in gradually, and maybe you can eventually get around E. Or like 1/5, sort of towards the bottom there, basically, right? But, you know, the point is, you have to take into consideration their physiology, their anatomy, what's reasonable, get the best voice you can that's safe and comfortable as well, right? So, you know, and again, just yanking the pitch up is not everything. It's important, the voice is important, but how they use the voice. Is it staccato, or is it more smooth and legato? So, let me try to read something more staccato. Join us at the Pride Center, University Student Union, second floor of the Soul Center, light snacks provided. Okay, versus, join us at the Pride Center, University Student Union, second floor of the Soul Center, light snacks provided. Okay. First one was sort of choppy, kind of in my throat. The second one is what we call very smooth flow phonation, letting my voice ride on the air. And we also sometimes call it more legato, which is a term for music meaning smooth and connected. And that's what we want. So it's not just about bringing the pitch up. It's also about how they're using the voice, how they're producing it, right? Along with artic, along with tweaking the formants. So the average for the male, the biological male, about the average speaking pitch is 110, but between 90 to 175. For the average female, about 220 or 175 to 165. All right. Techniques, I just showed you one. Frontal tone focus, right? Being forward, resonant voice. Straw phonation can be helpful. Should have brought one. Joseph, would you want to demonstrate? Right, so when you phonate through a straw, either with or without water, looks like you're
Could be without.
Yeah. Yeah. Right. So he's getting a lot of vibration and buzziness here. When you phonate through a straw, you're actually lengthening the vocal tract and you're increasing something that's called the inertia, and which I won't go into. But basically, it enables the folds to vibrate more easily, very relaxing to the voice, and it gets you to feel your voice in that frontal tone place. Sorry.
No, you're okay.
So, you know, begin somewhere between that 150 and 185, right? As long as it's comfortable. Okay. You can gradually increase it and move it around. Okay. Then you can start to play with pitch range a little bit. Like for example, 90, 91, 92, 93, 94, 91, 91, 91, 91, 91, 92, 91, 92, 91, 92, right? You start to play with inflection a little bit, and you can start to then expand the inflection, right, a little more, okay? You know, for conversation, the usual pitch range is about 12 semitones, I'm sorry guys, 12 semitones, okay? So that's almost an octave, okay? We want someone to have some inflectional range. For females, about 165 to 311, males 93 to 175 inflectional range. So, you know, if we can get our clients, you know, when we say declarative, I went away, right? Did I go down or up at the end? Down, right? I went down. Are you going? I went up, right? So if we can have a range for them from 131 to about 247 or somewhere within that range. And that's less than an octave, not quite 12 semitones, but it's going to give them more of an inflection range. And again, you want to always bear in mind what's comfortable and safe for them to produce. For feminization, we want to bring the tone from the chest resonance into the face, into the head. We were just doing forward tone focus. The vowel formants, we want to E-ify a vowel, right? E-ah versus E-oh, E-ah, E-a, E-a, right? So instead of E-oh, E-ah, you can hear the timbre on the ah staying brighter, right? So we want the vowels to be in the front of the mouth, with we call it E-ification of the vowels, right? Getting them a little brighter, bringing those formant frequencies up a little bit, right? You could start with an unvoiced consonant and then put the high front vowels with it, and you can gradually work to the back. So that's good. Okay. If you hear hard glottal attacks, have zero tolerance for them, because hard glottal attacks will pull them back into their throat. Okay? And we're trying to get them out of their throat and into the mouths. Breathiness. Sometimes people will come in with excessive breathiness because they're trying to have a more feminine sound, but that can cause tension. It doesn't project over noise, and being sort of artificially breathy can cause some tension patterns, right? So we don't want that. Definitely don't want those. I had a client who, man, I just could not get her out of fry. We'd be in resonant voice, we'd stop practicing. She'd tell me, you know, when she was coming the next week, and she'd be right back down into fry. Where you are. Say that again. Let's schedule again. Say it up here, right? Because this will pull you right out of that frontal focus, and glottal fry is very low frequency, right? It's like 90 hertz, 80 hertz. It's way down there. So we don't want them down there. Hoarseness. If they're hoarse and it lasts longer than 2 weeks, they should be seen, right? Because hoarseness, if you can't connect it to an upper respiratory infection, if you can't connect it to some kind of cold or flu, any hoarseness that lasts more than 2 weeks that's not due to some cough that's still resolving should be looked at, right? Because it could be anything. It could be reflux, allergies, polyps, nodules, who knows, right? Okay. So if you're hearing hard glottal attacks, and you can use something called easy onset, which I demoed earlier, apple versus apple, right? You can teach linking. So instead of 2 apples, 2 apples. Red apple versus red apple. You can teach linking, which will give you that flow phonation and that sort of legato kind of speech. Okay. Intonation, inflection. We know from the research that females tend to inflect more, and we use inflection or intonation more than stress to make a point. Right? Okay, to emphasize meaning. So, it was so whatever. Right? Okay. Males tend to be a little more monotone. They use increased loudness to emphasize meaning more often than stress or a change in inflection. Right? So we want to train a greater inflectional range, right? To the degree that we can with the anatomy that we're working with. Right? Articulation, again, easy onset with the vowels. Get them to prolong the vowels a little more. Okay, so that's one thing that females do. Consonant precision, so sometimes just the cue of think of all the words being on your teeth actually brings things forward and is more crisp. You know, they'll notice that they're just cleaner. And to be honest, most of the sounds in English are forward. Light contact, light articulation. Already talked about smooth speech. Women tend to open their mouths more when they talk and have more lip rounding, which is kind of interesting. But opening the mouth more will also help with projection. Right? So if you're trying to be louder with a higher voice without yanking up the pitch even more, just getting them to open the mouth more and having good respiratory drive will help a lot. So sometimes it's the basics that we want to train. Speech rate and intensity, males tend to talk louder, faster, females tend to pause more frequently, and maybe prolong individual phonemes more. So there's some differences in speech production. Language, all kinds of gender or male female differences there. Females, we tend to use more adverbial or tag clauses, like, I did a good job on that test, I believe. She's going, unless she changes her mind, right? And that tends to be something that females do more often. So we can do some training in the areas of language, right, which will help as well. Semantics, believe it or not, men and women use different words for different purposes and sometimes have different meanings for the same word. Women use the intensifier so more often, show greater use of adjectives and adverbs, and less use of slang and swear words. Good. So things to consider. And this is like a tip of the iceberg. There's tons of studies out there on this stuff, tons. Not as much on voice, and certainly not efficacy studies in our field, but there's tons of research on the differences between males and females with language, with syntax, semantics, all that stuff. Discourse, pragmatics. Females tend to be more elaborative. It makes my husband crazy. I have to tell him all the details. That's kind of who I am. And he's like, okay, I've got it. I'm like, no, and so their point is important. You're not going to have it unless I tell you this. He's like, I have it. Right? So I know this is true for me anyway. We communicate to share thoughts and feelings, give more disclaimers and qualifiers, communicate to build consensus, and I mean, this is a department filled with females, and I'll hear, well, don't you think that blah, blah, blah? Well, but blah, 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 and don't you think, right? Trying to build consensus, do you agree, blah, 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 right? Use nurturing phrases, and again, remember these are USA studies. These are studies done in the States, and so when you're working with a client, please remember they're just not transgender culture. They have, other culture as well, right? Okay, so, maybe they're ESL, right? And they've got, I don't even know about the studies in other languages, so that's a whole other area, right? But they have, they have culture in addition, right? So, we use more terms of affection, more self-disclosure, I feel, blah, blah, blah. From the research, males tend to communicate as a means to establish a place in the hierarchy, communicate to acquire information, less likely to ask questions in public. And if I think about all the classes I've had, and the amount of males that actually ask questions often, I'd have to say that it slants towards the females, to be honest. More studies on pragmatics and discourse. Women communicate for intimacy, desire to be connected to others. Men tend to give information while remaining independent from the other party. Women try to avoid the appearance of superiority, where in some studies men actually more comfortable telling others what to do and appear superior. I hate to tell people what to do. I like to give some options and some guidance, and then they need to make the decision. I mean, we could go on and on. There's just tons of this stuff out there. But if you're going to work with these clients, I think it behooves you to know, to go into the research and see how communication differs between male and females on all these levels. Because if you have a client that has a lower voice type, and there really is appearing to be a limit to how much you can bring them up safely, right, you're going to have to work with vowel formants. You're going to have to work with style of speaking, flow, phonation, no glottal attacks, zero glottal fry, and work with some of these other areas, right? So you do have to be aware and know them. Okay? Yeah, there's tons of this stuff. So if anybody wants like a copy of this, I'll give you a PDF of it. Nonverbal communication. There are definitely differences, right? During the initial 30 seconds of an interaction, we draw 6 to 8 conclusions about a person before they've even said a word, which is really pretty amazing when you think about it. So nonverbal behaviors include body movements, kinesics, haptics, touching. You know, I'm a touchy person. Proxemics, the distance between two people. Oculesics, use of the eyes, olfaction, physical appearance, use of time, mimics. So all of these things also vary by male and female. So other things to keep in mind. I'm looking around. The last time I did this talk, the the males in the audience were a perfect example of this. It was great. I pointed to like 3 of them. It was perfect. But if I look around, cross legs, cross legs, cross legs, more cross legs, arms kind of like this, women kind of take less personal space, right? Women tend to sit face to face, stand closer, and then sit side by side or at a greater distance. So there's body movement that can vary, right? Okay, use of the eyes. Women maintain greater eye contact, right? Longer, tend to gaze more. Men tend to show less eye contact overall, except they have visual dominance. They'll make longer eye contact when they're speaking, but not when they're listening. I always nail my husband on that one, because once his eyes start to drift, I'm like, what did I just say? Something about something. Like, okay, you went away. You drifted, right? So there's differences in eye contact, right? And again, just bear in mind the culture of your right? That there's more than just the transgender culture, there's their culture, how they grew up, what they relate to, right? So this was really truly just a quick overview, because if you're going to see these clients, you really need to know a lot about the differences between male and female communication, not just voice, but language, anartic, right? Body language, all that stuff. Because again, voice isn't everything, and sometimes we can bring a voice up where it really does sound fantastic. Other voices are a little lower, and it's a little more work to bring them up to where they really pass for female. So we need to pull from these other areas. So any questions or anything? Sure. No? Okay. If you're interested in working with these clients, I think your best bet is to shadow someone who does it a lot, who works with a lot of these clients, right? Because the more experience a person has with working with transgender clients, sort of the richer, when you have experience with anything, right, you know more about how to get the best out of your client.
Mm-hmm.
You just do. The more experience you have. So if you're interested, find someone who works with this population and shadow them.
Mm-hmm.